Ms. Rivera, if you were queen for a day and you had unfettered discretion to establish a national rule on abortion for America, what restrictions, if any, would you implement with respect to abortion?
Thank you for your question, Senator. I would, so the American College of Obstetricians and Gynecologists opposed restrictions that are not based in medicine, right? People need to be able to make their own reproductive health care decisions, and having arbitrary restrictions lead to the situations like we've been hearing about, like Kate Cox and others who are not able to get the health care they need during obstetric emergencies. We know the majority of people access abortion services early.
Maybe I wasn't clear, because I've got to ask each of our witnesses here. Just tell me, if you could implement any rule, what restrictions, if any, you would put on abortion.
Senator, arbitrary restrictions put women's health in danger.
So that means no restrictions?
Senator, healthcare needs to be driven by medical practice and medical standards of care.
You don't believe in any restrictions on abortion?
Healthcare needs to be driven by medical standards of care.
Well, your website says you support abortions at all gestations. So
that is correct, because
you support abortion
needs
without
to be made
any
available
restrictions
based on medical standards of care.
How about, could you get it, if the mother's healthy and the baby's healthy, would you support an abortion the day before birth?
Actually, that is not how abortion care works.
Yes, ma'am, but would you support that? You say no restrictions.
That is called labor and delivery, Senator.
But you support no restrictions.
That is not how abortion care works, and it's
sure
really,
it does.
That is not how abortion
my question's
care
simple.
works, Senator.
Would you have a rule saying that if a healthy mother with a healthy baby wanted to have an abortion the day before birth, would it be okay with you?
Senator, that is not how abortion care works, and it's really dangerous. That rhetoric is really dangerous for the people who are confronting
It would be
these
okay with you, wouldn't it?
That is called labor and delivery, sir.
It would be okay with you,
That is
wouldn't
called
it?
labor and delivery, sir.
I find that astonishing.
Senator,
I noticed
that is
it
really
on your
offensive.
website.
That is really offensive.
You
to
issued
the
a
people
press
needing
release.
to
You
access
don't
abortion
refer to
care.
mothers. You say at your organization, you don't refer to mothers. You call them birthing people. Is that right?
That is among the language that we use, yes.
What's the difference?
A birthing person is someone who's in labor and delivery.
Okay. That's a mother, right?
So for sure, the majority of people who are pregnant are cisgender women, and at the same time, we have to acknowledge that trans people and non-binary people do and can become pregnant, and it's really important not to misgender them in law and health because it is really dangerous to them.
You were invited here by my Democratic colleagues today?
That is correct.
Okay. Dr. Denard, if you were queen for a day, what restrictions, if any, would you place on abortion?
Well, if I was queen for a day, I would use shared decision-making between myself and my patients so I could take really, really good care of them.
So you don't think there ought to be any restrictions?
You know, that's not really how abortion care works. We need to be able to take care.
Yes, ma'am, but I'm trying to understand your position first. Do you support any restrictions on abortion?
I support my patients, I trust women, and I know that they're going to make the right decision for themselves.
Okay. And you were invited here today by the Democrats?
Correct.
Okay. Professor Sneed. Well, let me back up. I don't have much time left. How would you change Texas law? Would you Are you suggesting that Texas should adopt a law that's saying there should be no restrictions on abortion?
Are you asking me?
Yes, ma'am.
Yes. If I could change Texas's laws, I would be able to take care of my patients if they're in need without restriction.
I just find it extraordinary that neither you nor Ms. Rivera are willing to say what you believe, which is clearly that you don't think there ought to be any restrictions on abortion. You think it's okay. You want society to adopt a rule that says if a healthy mother with a healthy child wants to have an abortion, maybe she wants a different gender the day before birth, that's okay.
Senator,
you both seem, it's clear that's what you believe. Why won't you say it?
with all due respect, I've been to medical school. I've done multiple years of training, delivered babies, and done thousands of surgeries for over a decade. And you're describing a clinical situation that just doesn't exist, Senator.
No, ma'am, you're wrong. You're wrong, and you know I'm wrong. Do you perform abortions, doctor?
I am not an abortion provider.
Okay. Have you ever done an abortion?
I have never done an abortion, but I take care of my patients who are actively having miscarriages.
Okay. I think I'm over. Thank you for your indulgence, Mr. Chairman.
Senator John Kennedy is questioning witnesses during a Senate hearing about abortion laws. He asks each witness the same core question: if they had full power to set a national abortion rule, what restrictions, if any, they would support. Ms. Rivera argues that abortion decisions should be based on medical standards, not political restrictions. She says that limits not grounded in medicine endanger women, especially during medical emergencies. Kennedy presses her repeatedly to specify whether she supports any restrictions. She keeps repeating that medical professionals, not lawmakers, should decide what's necessary. Kennedy pushes a hypothetical: if a healthy mother and healthy baby wanted an abortion the day before birth, would she allow it? She avoids the yes-no answer and says his scenario is unrealistic and not how abortion care works. Kennedy becomes visibly frustrated, saying her position implies no restrictions at all. Kennedy brings up that her organization uses the term birthing people instead of mothers. She explains that this includes transgender and non-binary people who can become pregnant, and says using only mother misgenders patients. Kennedy highlights that she was invited by Democrats, implying political bias. Kennedy asks the same question: would she support any restrictions? She says the focus should be shared decision-making between doctor and patient. Kennedy tries again to pin down her stance, but she repeats that she trusts women to decide. Again, no clear restriction is mentioned. Kennedy points out she was also invited by Democrats. Kennedy asks another witness whether Texas should have no restrictions on abortion. She answers that removing restrictions would allow her to care for patients properly. Kennedy becomes frustrated again, saying none of the witnesses will openly admit that they support abortion with no limits. Kennedy gives another hypothetical: if a healthy woman with a healthy baby wants an abortion a day before birth, maybe even for gender preference, would that be allowed? He says their refusal to directly answer shows they believe there should be zero restrictions. A doctor responds strongly, saying the scenario Kennedy describes does not exist in real medical practice. Kennedy insists she is wrong. He asks whether she has ever performed an abortion. She says no, but treats miscarriage patients. Time expires. The entire exchange centers on Kennedy trying to get witnesses to admit they support abortion without limits, especially late term. The witnesses insist his scenarios are not medically real and argue abortion restrictions should be based strictly on medical standards, not politics. This creates a tense back and forth that highlights major disagreements over late-term abortion, medical decision-making, political involvement, gender-inclusive language, state versus national abortion laws,